Some days I can move mountains, and other times I can't get it right. But every mountain that I'm climbing.
Hi, I'm Dan Davis, and this is the show Walking Through Life. Today we're going to be interviewing Hilda Odway, Executive Director of the Good Neighbor Health Clinic.
Hi, thanks for having me on the show.
No problem. So, what exactly do you do in your job?
Well, the Good Neighbor Health Clinic is a nonprofit organization, so my job there is to carry out the management for the organization, to make sure that all the programs are provided the way that the community would like them provided, that we spend the money properly, that we have the staff, the volunteers, the employees to carry out the mission of the organization. And also, like today being on the show with you, is to help let members of the public, patients, volunteers, supporters know about the services, the free medical and dental care that's offered at Good Neighbor Health Clinic and Red Logan Dental Clinic.
What kind of programs do you offer?
Well, we do free medical and dental care. So let's start with the free medical care, because that's how the clinic got started. About 20 years ago, people in the community got together and said, what happens to someone who's homeless? Where do they go to get their health care? Besides the emergency department, is there any place to go? And we found out there really wasn't. There really wasn't a good option. So this group of folks got together and formed the Good Neighbor Health Clinic. And the idea is that, let's say that you needed medical care, but it wasn't so serious that you wanted to go to, you didn't want to have to go to the emergency department, but you really need to see a doctor, and you don't have the extra $100 or $200 to do that. So you can come to the Good Neighbor Health Clinic, and you see one of our doctors there, and they're all volunteers. They're some of the best doctors in the whole Upper Valley who happen to volunteer there. And we do basic medical care, so nothing too fancy. So we're not doing any surgeries there, we're not doing x-rays, we're doing the kind of medical care you do if you just called up to see your regular general practitioner. Maybe you had an earache, a sore knee, maybe you've had diarrhea for a couple of weeks, all sorts of things like that that are really not emergencies, but you need to see a doctor. So that's the medical side of things. On the dental clinic, it's kind of the same idea. The group got started a little bit later, that lots of people, well really all of us, need to see a dentist from time to time. But if you don't have money to go see a dentist, you're likely to put off that care until your teeth really start to hurt. And by then it might mean you lose a tooth, you're in a lot of pain, and we really don't want that to happen. So again, we have really wonderful dentists who volunteer their time, and they provide free dental care to people. So that's basically what we do.
So, this is a odd question, but what exactly, are there actually exactly homeless people around here?
Oh, I'm sure there are, but it's interesting, though, although the clinic got started for the idea of working with homeless people, now most of the people we see are actually working. They've got jobs, they've got apartments or homes, but they still can't afford medical care. But getting back to the homeless people, it's funny because in the big cities, you know, a lot of us think of going to Boston or Montreal or New York or places like that. The homeless people who have no place to stay are pretty obvious because there's so many, you'll see them sleeping outside. Here in the Upper Valley, most of the people who are homeless, and there are people on any given night, there's about 50 people who don't have a place to stay. So where are they staying? How come you don't see them on the street? Well, they're sleeping in cars. In the summertime, they're sleeping in tents. They might be staying temporarily at your house. You know, maybe you have a friend who's between jobs, or maybe they've broke up with their boyfriend or girlfriend, or for one reason or the other, they don't have a place to stay anymore. Oftentimes they'll stay with friends for a few days and then go and stay with another friend. And people usually call this couch surfing, you know, because you're moving from one couch to the other. So you're homeless, you don't have a place that's your own, but you're not on the streets, you know, the way that you think about homeless people in big cities. But it's a big problem. And among young people, you're a young person, a few years ago I really looked into this a lot with a group of folks. And again, on any given night, there's about 25 kids, 25 people who are young adults, I'd say, you know, between the ages of 15 to 22, who have no place to stay. And usually that happens, and I'll bet you can think about people you've known in your own life where this situation was applied. Oftentimes, parents are having fights, and there's a lot of there's a lot of fighting going on in the household. The most common thing that I would see, that reason a kid would become homeless, is the woman, the mother of the children, would have a boyfriend who basically says, you need to choose between me and the kids. We can't live in the same house. There's too much fighting. You need to choose. And the mother will choose the boyfriend. And the kids are on the street. It's really sad, but that happens a lot. So again, any given night here in the Upper Valley, I would say there's about 20 kids living on the street or moving from place to place. And it's usually the reason for that is, there's the family just can't get along, and the mother or the father said, you're on your own. Get out of the house.
Wow. I asked that question because I seen homeless people in Barrie
Right.
walking around. Like, I think there was this guy who we saw several times who was moving around, and there was this guy with this long beard, and he seemed like he was just arbitrarily falling. But so how successful do you think your company has been?
Well, it's hard to measure how successful we've been. I think the good news is we've been successful keeping a lot of people out of the emergency department, which is a good thing. You don't want an illness to progress to the point it becomes an emergency. And on the other hand, you don't want things that are not emergencies, like let's, again, for example, say that you had a bad earache. Well, that's bad, and it's maybe keeping you up at night, but you don't need to go to an emergency department for that kind of treatment. So I think one of the things we do well is on a weekly basis, we keep people out of the emergency department, which saves them pain and suffering. It saves the hospitals. So that's one measure of how well we do. Another example is, let's take a chronic illness. That means an illness that you have now and you're going to have your whole life. It's not going away. It's chronic, means it's always going to be there. Mm-hmm. Diabetes is an example of a chronic illness. So we have about anywhere between 40 and 50 people who come to the Good Neighbor Health Clinic who have diabetes. And we help those folks manage their diabetes. Okay, it's not going to go away, but we help them manage the illness so that they don't get real sick and they don't end up in the emergency department again. So that's another example of a success where people might not be cured of the illness that they have, but if we help them manage it well, they can live with it and not get so sick that they can't function or so sick that they end up in the emergency department.
Or die.
That's right. That's the last thing we want to happen.
Yeah, I said I was almost pre-diabetic once, and then I lost a lot of weight. But so when you become diabetic, it's usually it's pretty much forever.
Yeah, it's just something that you live with, and you can live with a lot of various types of illnesses. You just adapt.
I don't live with any kind of illness. Mm-hmm. Actually, well, I do have another problem, but it's not an illness. Mm-hmm. But getting back to what I was saying, so the Good Neighbor Health Clinic, how long has that been around for?
It was started 20 years ago, and it was started. Now, you're pretty young, so you won't remember this.
No, but I wasn't even born.
That's right. But 20 years ago, Bill Clinton had just been elected president, and he ran, part of his election promises was, I'm going to offer universal health care to all Americans. And at the same time, in the state of Vermont, we actually had a doctor who was our governor. His name was Dr. Howard Dean. And he also was very much in favor of providing health care for all residents. So the folks who were involved in starting the clinic, and I was one of that group, we really thought it was just going to be temporary. We thought, well, with the changes on the state level and the federal level, there won't be a need for anything like this in a few years. So we'll just get this going for the next 4 or 5 years, and then it'll disappear. But it's 20 years later. It's not going away. And the big news this week, I don't know if you happen to notice in the papers, but the big news was that the Supreme Court upheld some of the healthcare reform that was pushed by President Obama.
I heard about that.
Yeah. So does that mean we get to say, oh, great, we're done, let's all go home? No, far from it. Because these laws are going to take a long time to implement, and we're really just not sure how it's going to really impact low-income people. So we'll wait and see. We know we're going to be around for a few more years at least.
Well, doctor, help me. Now to get into the healthcare subject or the medical center, I mean the Good Neighbor Health Clinic. But is there anything you do in your personal time? I mean, I don't mean to ask, but...
Oh, yeah, sure. I think it's important. I think all of us, you have to keep balance in your life, right? Mm-hmm. That job, like many other jobs, I could work there 7 days a week, 12 to 14 hours a day, and I'd never catch up with my work. I'd never catch up because there's always more to do. So things I like to do, especially because I see the importance of health, I'm very good about exercising myself. I love to play tennis, I like to swim, I like to bike, I like to walk, so I do all those things. I like doing it, it's fun. And I usually do it with other people, so that makes it even more fun. And also, again, from what I see during my job, I know it's really important that I continue to do that, or else there's no doubt. I'm 55 years old, I'm not that old, but you can't go
Oh,
through.
you don't look like you're 55
But I
years
am.
old.
See, it's all that exercise. So you have to really take care of yourself. You can't not exercise, not eat right, not get sleep, and then expect, like you were joking a few minutes ago and going, doctor, fix
Yeah.
me. The doctor can't fix you. Most of it's up to us. So those are some things that I like to do outside. I also like music. Do you like music?
Oh, I love music.
See.
I love listening. I usually like listening to just random music that makes me move. I'm not a big fan of really slow music.
Yeah,
Dancing's really good exercise. You know that?
yeah. So I love music too. So
Wait, what'd you
those
say?
are some
I'm sorry.
things.
Dancing is really good
Oh,
exercise.
yeah, it is. I do dance a lot when occasionally, like I was listening to a bunch of soundtracks last night.
Let me tell you something we're doing with music, which is kind of cool. So, so in working in this job, I get to know a lot of the volunteers. They all do different things. You know, maybe somebody's coming in and filing the patient chart all the way to the doctor who's doing the treatment. Well, I noticed a lot of our volunteers were musicians, and pretty good musicians too. For example, I looked in the drawer one day and I saw a CD and it had one of our volunteers' names on it. And I thought his name was on it just because it was his and he wanted it back. But I put it in the CD player and it was him playing. Beautiful. If his name hadn't been
Oh,
written on it,
pardon me, what was he playing?
he was playing the classical guitar. This was Dr. Bob Alvarenga. He doesn't like to perform publicly, but I'm telling you, he's a great musician.
So he's kind of shy about it.
He is, but he's great. I mean, his CD was so awesome. And then I started talking to other musicians and volunteers and finding out just a lot of doctors, nurses, dentists, just like everyone else in the world, a lot of them are musicians. So we put this together and we thought, wouldn't it be fun to feature our doctors and dentists and put on a show with them playing? So we're calling it Music as Medicine. And we're going to have a show in Saturday, November 10th. It's a long ways off, but still something
Yeah.
to think about.
I said I probably won't be able to see it because I'll be in college.
That would be great for something for Walking Through Life to cover, too.
Yeah.
I
But
said, yeah, I want to be a stand-up comedian, actually. So I have a career ambition.
Well, you know, someday we should do a show called Laughter as Medicine, and who knows, you might be involved at that point. But anyway, so that's those are some things that I like to do outside, and I think that a lot of people have great hobbies like that, whether it's sports or music. So we're making that connection, and that music as medicine will help benefit the clinic to keep services going, and it'll also be a good way to encourage people who are volunteers to do a really wonderful activity outside in their personal life.
Oh, well, excuse me, but we're starting to run out of time.
We are already?
Yeah, it's
Dan,
like
you're so
45
good. Time flies.
I said, yeah, I was surprised too. But is there anything else you want to say? Just, you know, anything else you would like to say?
Sure. Let me give some basic numbers for people to call if they're interested. So I'll just take a minute to do that. Is that okay?
Yeah.
Okay.
fine.
So if people are interested in finding out about the Good Neighbor Health Clinic, the medical side, they can call us. Our main office is in White River Junction. I'm going to give two numbers, a toll-free number and the regular. So you can call 802-295-1868, or if you need a toll-free call, it's 877-552-4815. Now, if you're interested in dental care, we didn't get a chance to talk too much about the dental care.
Oh, I'm sorry.
No, that's fine, but it's the same basic idea. That number is 802-295-7573, or you can call toll-free 877-552-4820. So call those numbers Monday through Friday between 9 and 5, and we can tell you about what services are available. And the main things that we look for to know if it's a good match is, what's your issue? We don't want to say, yeah, you're having a heart attack, come on in. Nope, that's not what we're going to be able to do. So the first thing is we find out, what is it that you need? Can we do that for you? Now, question number one. Question number two, what is your income? Because we're only serving low and moderate income people. So if you make $100,000, sorry, we're not going to be able to serve you. Question number four, Do you have any kind of insurance? Because if you already have insurance, then you can go to another doctor, and that's not who we're serving. Unless you have a high deductible. If you're low income but your insurance deductible is $1,000 or more, we'll be happy to serve you. And the last question is, where do you live? We try to serve people who live about 20 miles from White River Junction. So if you think of a circle coming around, that's our basic service area. So those are the main high points. I hope you'll call us again. It's a Good Neighbor Health Clinic. We're right across the street from CATV. We're located at 70 North Main Street in White River Junction. We do offer satellite clinics in Enfield, New Hampshire, and Lebanon, New Hampshire, to make that a little bit more convenient for folks.
I probably won't call you because my mom pays for all the medical. You know, my mom goes to the doctors.
That is lucky you. And plus, you're young and healthy, so you might not have as much need.
No, I don't think I need any problems right now. But I said, thank you, Ms. Ojue, for agreeing to come here, and I wanted to say,
Yeah, thanks very much for having me.
I'm just here in the middle. I don't count.
yeah, don't mind her. She's just the observer.
She's like the beautiful flowers on the table.
Yeah.
There you go.
Well, thanks for. Well, this is Walking Through Life. I'm Dan Davis.
Some days I can move mountains, and other times I can't get it right. But every mountain that I'm climbing brings me one step closer. Raise my eyes to the morning, looking down a road that seems so rough. But if you ask me, I would tell you I still ain't had enough. Walking